It's a story you'll only see on NBC 26. Opioid abuse now considered an epidemic in Wisconsin. And you might not realize it, but babies and children are paying the price. NBC 26's Marissa DeCandido joins us now with those details.
In 2009, the Wisconsin Department of Health Services found 335 women had used opioids when they came in to give birth. In 2014, that number rose to 1,041. That's a 211% increase of women using opioids while pregnant. And the problems only begin for moms and their children once they reach the hospital.
It definitely can be frustrating.
For NICU doctors at HSHS St. Vincent's Children's Hospital in Green Bay,
To see this happen over and over again.
it just keeps happening.
Brown County and the local counties that we serve have also seen an increase in the past few years.
Babies going through withdrawals because of a mother's opioid abuse.
Babies born to moms who are taking an opiate medication or an illegal opiate like heroin. About 60 to 80% of those babies will withdraw.
This video from NBC News shows what it looks like when a baby withdraws.
Sweating, higher temperature, general fussiness, or just discomfort.
And it's something Dr. Lynn
Actually also risk for seizures.
has treated firsthand.
Then we unfortunately have to use medication to help control those symptoms and wean the baby down.
Neonatal abstinence syndrome is a baby's withdrawal caused by a mom's drug use. In Wisconsin, it occurs in nearly 1% of all births.
Long-term implications don't really go away even with treatment in the newborn period.
And the problems don't end in the hospital.
So what we're finding is children are remaining in out-of-home care longer.
That's because of parental drug use in Outagamie County,
This is a huge issue.
affecting the kids
Them just being separated and in limbo causes trauma.
and even the children, youth, and family staff.
Secondary traumatic stress in our workforce is huge.
They even have the county's alcohol and other drug abuse specialist on the same floor because the department's need is so great.
We have an immediate connection available for the social workers and available for those families.
Even with treatment, it's difficult to recover.
I wish that we didn't see so much recurrence with the same moms.
But still, there are options for help.
It's a disease, and having some compassion and understanding without judgment or shame is important.
To try and curb this statewide epidemic.
31% of kids in Outagamie County foster care are there because of parental drug use. If you think parents you know are abusing drugs and putting their children at risk, contact your county child services immediately. Keeping you connected, Marissa DeCandido, NBC 26.